Hi there, and welcome to the Institute for Natural Medicine's podcast, The MD Will See You Now. On this podcast, we talk to naturopathic doctors all across North America about their whole person approach to health, what patients can expect, and why their work is so very vital to patient health. I'm your host, Anna-Liza, and today I am just delighted to speak with Dr. Bryant Esquejo. And Bryant is a California licensed naturopathic doctor. He's got a private practice at Jupiter Naturopathic Wellness in Los Angeles, California. And Dr. Esquejo specializes in adjunctive integrative gastroenterology. That means digestive health. Also endocrinology, and that means hormone health. As if that wasn't enough, he's also the co-host of the Holistic Beauty podcast. Dr. Esquejo, such a pleasure. Thanks so much for joining us today.
Thank you so much for having me on. I'm really excited for this conversation.
As am I. Well, let us not delay and let's just get right into it. So you're on a podcast now today, but you have a different side to this podcasting situation too, because earlier this year, you and your colleague, that's by the way, naturopathic Dr. Marilyn Marola, you yourself launched the Holistic Beauty podcast. And for those folks that haven't heard it, a really cool podcast, because what you and Marilyn do is you basically empower and educate people to improve their skin health using a more natural approach. And the way that you do this is by uncovering these deeper root causes of skin conditions. And folks, just to give you a sense, so far you've covered quite a few topics, such as the role of hormones in adult acne. And yes, adult acne is a thing. You've looked at the links between gut health and skin health. You've taken some deep dives into topics like eczema, the importance of skin protection. So all that being said, Bryant, can you tell me more about some potential root causes of skin conditions?
Yeah, so it all depends on what the skin condition is, right? So we spoke about that a lot on the podcast, but from what I see a lot of my practice is that gut health is so important to look at. But going back to like what a naturopathic doctor does, right? We really want to figure out the root cause, identify that root cause, and treat that root cause. And like what I said, gut health is one of them, but there are so many other things that I really want to figure out when a patient first sees me in office. And in regards to underlying causes, let's take acne, for example. In regards to acne, we do know that gut health is linked to acne. However, there are some things that happen on the skin level, but also things that happen deeper from within. So usually when the patient sees me for like chronic, inflamed, like deep, painful acne, that tells me that something else is going on other than what they're putting on their skin. And of course, like skin stuff does like, or the, how would you say it? Skincare does play a role in some acne. But these underlying causes could be hormones as well. We do know that hormones do play a role in the development of acne. Beyond that, we also know that diet can actually change acne-causing hormones. And it's actually really interesting. And looking at diet, when we look at these like other nutrients, supplements can also play a role as well, because, you know, some supplements are basically nutrients, but at a higher dosage. Beyond that, we do know that certain nutrient deficiencies have been linked to acne as well. So it's really trying to figure out like what is what for the patient right in front of me, you know? And that's why I like to have a really comprehensive intake with a patient, just like really try to sleuth out and sieve out what the potential underlying causes are and get the appropriate labs for me to really understand like, oh, hey, this is the actual root cause. Let's treat this root cause and see how your skin health changes with addressing that root cause.
Yeah, that's a lot of stuff that I imagine many people might not have thought about. Now, you mentioned diet. Maybe that's the low-hanging fruit, for people thinking about things like, what we would call not great foods, whether that's processed foods or high sugar, high fat, that kind of thing. But yeah, the hormone angle and the gut health angle is really interesting because when we look at root cause, these really are deep, deep causes, deep within the body. And I like the way that you've described when a patient is coming in to see you, you're really taking the time to investigate, if you will. And as you said, it's really depends on the patient in front of you. It's very individualized, but you're doing things like doing lab tests. You're taking a really thorough patient history. And, it's good that you're going into that process, knowing that some of these things could be root causes. So you have a sense of what to look for based on your experience, but you're also waiting to see what that testing reveals. So that takes us to the next stage. So let's say you do your assessment, you have your testing back, you now have a lot more information with which to proceed. So now that you've given us a very good sense of what some of these potential root causes can be, can you give us a sense, Bryant, of how you may use naturopathic medicine to address these root causes?
Yeah, the really cool thing about naturopathic medicine is that we're basically holistic and integrative medicine experts, right? So, holistic meaning that we do want to treat these underlying causes, but we have the opportunity to treat these underlying causes with integrative options. In the state of California, it's very different in regards to integrative medicine. So, we mainly rely on our natural options. In regards to these natural options, it could involve diet. So, in regards to diet, there's some really interesting diets that have been linked to acne, actually. So, the overconsumption or just eating too much of simple carbohydrates like sweets or even just like certain types of breads, pastries, all of those basically can shift hormones and therefore play a role in acne. And then in regards to diet, there's also what is it? Dairy has a protein in it called whey protein, which is also a supplement. And in regards to whey protein, it can basically trigger hormone changes that could lead to acne as well. And there's some really cool literature that actually speaks about how whey protein is linked to body acne, actually, usually acne around the trunk or the abdomen. So that's something that I might actually focus on with patients from the get-go. It's going to be diet. And then if their labs end up showing like, hey, there are nutrient insufficiencies, we're going to address that as well. So there's some really cool science saying that vitamin D deficiency has been linked to acne. We don't really understand what's really going on just yet. However, some researchers are suggesting that vitamin D plays a role in inflammatory response. And we do know when people experience these like red, painful lesions or red, painful pimples, it's usually an inflammatory response. And that's what they're thinking could be going on. When somebody has low vitamin D, they have higher levels of inflammation. In addition to that, we also might check zinc as well. If somebody's lab show that they have some zinc deficiency or zinc insufficiency, we're going to replete their system with zinc. And then, so beyond those labs, there are some other labs that we might end up doing with our patients as well. Some other underlying causes of acne is going to be polycystic ovarian syndrome. Polycystic ovarian syndrome is basically a condition where people can experience symptoms of high testosterone, like cystic acne, but they can also experience facial hair growth, body hair growth, head hair loss, and it usually takes place in females. In addition to those symptoms, they also experience changes to menstrual periods. Usually it's going to be irregular or absent cycles. If somebody does fit that picture and their labs and workup do indicate that there is some PCOS picture going on, we can address that with so many options. So there's going to be certain nutrients that can help drive down blood sugar, which has been linked to PCOS. So it's going to be diet, but also certain supplements. And then there's so many other things beyond PCOS as well. So it's going to be gut health. We spoke about gut health as well. There's a lot with acne. In regards to gut health, when I do see patients and their labs show that they have some gut dysbiosis, and dysbiosis basically means imbalance, we have a lot of options to bring their gut health back into balance. And in regards to gut health balance, it's really looking at how the gut bacteria is and how do we basically modulate that. And there's some dietary options that we can do. So we spoke about simple carbohydrates and dairy, but in regards to gut microbiome diets, there are some really cool studies saying that eating 30 different plants a week, 30 different plants a week can support healthy and diverse gut bacteria populations. In addition to that, there's some really cool science that says high fat, low fiber diets can increase somebody's risk for gut bacteria imbalance. So it's really looking at like, okay, how do we increase their fiber? How do we like really support their gut microbiome with diet? And if that doesn't end up helping out, or if their labs show very extreme gut bacteria imbalance, we might do some antimicrobial herbs. So in regards to those, there are a lot of herbs that can be addressed or that can be used to help bring bacteria back into balance. So it's really depending upon like if the labs show like, oh, it's more mild gut bacteria imbalance, or if it's more severe gut bacteria imbalance. And then we're going to speak about this in the next question, I think. But if somebody is experiencing more severe gut bacteria imbalance and then they're not responding to these herbal antimicrobial treatments, I may refer them out to a provider who can prescribe pharmaceuticals.
Well, yeah, that you're correct. That was a lot of things that could
Yeah.
be linked to this. And I'm really pleased, and thank you for doing so, that you're really pointing us to some evidence-based research. So this is, yes, what you're seeing with your patients and what you're using, but there's a really strong scientific background, you know? So you've mentioned, of course, things like simple carbohydrates, the dairy and the body acne link is really interesting because we tend to maybe not think of these skin conditions separately in terms of where they manifest. It might just be acne, you know? So that's really interesting that there's some separation there. And I want to just pick up a couple of things that you mentioned because you mentioned gut dysbiosis.
Yeah.
And you explained that for us a little bit, which I'm glad you did. I wonder if you can get into this link between that and this 30 plants a week. And I'm
Yeah.
glad you said 30 because I wasn't sure myself there. But yeah, can you get a little bit into this gut microbiome? So you've explained to us that when we look at dysbiosis, essentially what's happening is that we do have a community all up in there in our gut of various different bacteria. And sometimes when things get imbalanced, as you're mentioning, skin conditions can result. Can you give us a bit more insight into the role that gut dysbiosis may play, and really what you're hearing and seeing from your patients?
Yeah, so this is actually a topic that I'm so passionate about. So, the gut microbiome, if you guys don't know, is basically all of the microbes naturally found in the gastrointestinal tract or the gut. So, it's going to be from mouth all the way down to the butt, honestly. And in regards to these microbes, it can be bacteria, viruses, and so much more. They're basically all these microscopic things. However, these changes, from what I've seen in the literature, it's been mainly focusing on the actual bacteria in the gut. And what they're seeing is that certain gut bacteria overgrowths have been linked to acne. So, in regards to acne, it's basically like a gut bacteria imbalance. There's a really strong link with that. It's also been linked to eczema as well. In regards to eczema, what they're seeing is that there's actually a depletion of gut bacteria that's necessary for making gut supportive postbiotics, which are basically bacterial byproducts. And then, in regards to rosacea, it's actually being linked to that as well. So, what studies show is that people with rosacea, they're more likely to experience H. pylori infection. H. pylori is a bacteria that could grow in the stomach and play a role in like some burning sensations, kind of like ulcer-like symptoms or heartburn symptoms. But it's also been linked to SIBO. SIBO stands for small intestinal bacterial overgrowth. A small intestinal bacterial overgrowth can look a lot like irritable bowel syndrome or IBS. And then going back to your question, the 30 different plants, right? That's what you asked me about. So yeah, like what I said earlier, there's some really, really cool science. I think the actual study was called the American Gut Project. So if anybody wants to look it up, look it up. It's a really cool study. So in that study, what they saw was that eating plants, either it be fruits, vegetables, and it's also herbs and spices. So like you can get all of these pretty easily in your diet. And having 30 different plants a week, 30 different plants a week supports just like really diverse gut bacteria populations. And diversity is not only key for gut health, but from what I've said earlier, it's really supportive for skin health as well, because there's that link between gut and skin, which is so interesting to me. And I actually try to figure out if I could get 30 different plants a week, and I was surprised. So when I basically did like a 30 plants challenge for myself, and in that first week I was like, okay, I'm gonna see how much I could get. And I was actually surprised that I got 25 different plants, and I was like, oh, I just have to add like 5 extra plants this week. So easy. And the easiest way for me to actually get those 30 different plants was making smoothies every morning. And I actually post about that on my Instagram a lot, like how making smoothies is such an easy way to get these plants into your diet. So in my smoothies, sometimes I go pretty extreme and I get 20 different plants because I add so many different spices, honestly. It's so easy to add just like different spices. So I put like turmeric, black pepper, and people are just like, why do you put that? Is it gross? I'm like, no, you don't taste it at all, but you still get those 30 different plants, you know? But yeah, just to answer your question, 30 different plants have been linked to healthy and diverse gut bacteria populations, and gut bacteria populations have been linked to gut symptoms, but also skin health.
Wow, I really appreciate hearing about how you yourself personally challenge yourself to do this. And that's a really good tip. Or those are two good tips, actually. First, that smoothies are a nice, easy way to do that when you're looking at that type of quantity, quite frankly. And also, herbs and spices count, right? We
Yeah,
forget that they are also plants. Or parts of plants. And yeah, what a way to get that in. And hey, getting 25 on your first go, that's pretty good.
I know, I was surprised.
So now, just to end off today, Bryant, to take a little bit of a different tactic, you did mention earlier that, based on the way that the laws are that govern naturopathic medicine and naturopathic doctors and physicians in California, that you cannot directly prescribe pharmaceutical medications. That being said, you did mention that you work in an integrative fashion and a collaborative fashion with other types of healthcare professionals who can prescribe. So when we think about how this impacts patients, I'd love to get a sense of that from you. When you think about how you're collaborating with these other types of healthcare professionals, how are these types of collaborations directly benefiting patients?
Yeah. So when patients first see me, I always let them know what their options are, depending upon the severity of their symptoms, but also what they prefer and what their goals are, you know? So my patients definitely want to go more natural route. Other patients want to go more an integrative route. And integrative is really combining or blending both natural and conventional slash pharmaceutical options. And given that, a lot of my patients who do want pharmaceutical options, I let them know in the state of California, since I don't have MD oversight or medical doctor oversight, I can't prescribe pharmaceuticals. I let them know from the get-go. And they're usually okay with that. And then I always let them know, like, we can refer them out to a dermatologist that I commonly refer to out in Pasadena, which is a city in California, where they can get pharmaceutical treatment. And depending upon what we've done, it's a whole entire, just like, how would you say it, journey with a patient. So depending upon what we've done in regards to like natural options, and then just really being frank and straight up with them and being like, hey, we've done these natural options. You're not getting the results you want just yet, or the relief you want. We can give it some more time. It might help out, but like it seems like your timeline is much shorter than what we were really anticipating, you know? So in regards to that, I always let them know, like, hey, you have the pharmaceutical option available. And when I do collaborate with medical doctors or dermatologists, I also refer out to was a family practitioner as well. They're usually pretty cool with working with a naturopathic doctor, which is amazing. When I first started off in practice here in California, I went to school in Portland, so I didn't really know how things were like here in California. In my head, like I grew up here, I was like, okay, like people are pretty cool, they're pretty chill, you know, so that I would expect them to be okay with working a naturopathic doctor. And I was honestly just like afraid just because I didn't know how that experience would be like. Just because in Oregon, where I was doing my medical training, we could prescribe pharmaceuticals. We didn't really have to rely on like medical doctors. And given that unknown aspect, I was honestly just like kind of just like anxious, you know? But to my surprise, a lot of MDs are pretty receptive to naturopathic medicine. I just, from what I saw, is that I had to just break down what naturopathic doctors do, what our training involves, and they basically became more comfortable in regards to like, oh, this naturopathic provider, naturopathic doctor, is actually medically trained. He understands like what pharmaceuticals are needed, and I would love to collaborate with him. And it's really cool to basically have like a team of providers that I could reach out to in regards to like, hey, my patient needs some more support. Can you help them out? And like what I said earlier, they're usually receptive to that, and patients are happier as well.
That's wonderful to hear. And I like how you're using the educational aspect. You know, in many episodes of this podcast, we have stated the strong educational role, which we know is one of the principles of naturopathic medicine, doctor as teacher. And normally we talk about that in terms of how naturopathic doctors are educating patients. Right. But in this case, this is a really important other type of education, which is educating your colleagues that may be practicing healthcare in a method that is outside of the naturopathic profession. You've mentioned, you know, some medical doctors, family physicians, dermatologists, for example, and they really, after you do that education piece, right, and after you explain to them, hey, this is what I do, they seem to realize, oh, yes, these naturopathic doctors know what they're speaking about. They know the pharmaceuticals, they know the impacts, they know all this stuff. And it sounds like that's really what's paving this path for you to, you know, work in this way that, as you pointed out, is integrative by, you know, integrating natural therapies and naturopathic therapies with conventional ones, but also collaborative, you know. And I wanted just to end by asking you a bit about that collaborative piece. So when you are actually working with these other types of healthcare professionals, and that could be in a number of ways, as you mentioned, it could be because there is something that needs to be prescribed that you're not able to do, but it might also be a collaboration outside of that, because that is a fairly, you know, practical, logistical reason to collaborate, but there's others, right? So just to end off today, can you give me a sense, Bryant, of what this collaboration looks like from the patient's seat? What types of benefits are they receiving?
So when patients see me for when patients actually see me and they have this collaborative experience where they see me and another provider, a lot of them actually express like, hey, thank you so much for letting me know, like, these are what my options are. Because there's also like this really big fallacy, at least here in Los Angeles, where natural is always right. And I always let my patients know, like, natural sometimes isn't the best option, especially for your goals. And just being straight up with them and being like, hey, pharmaceuticals are okay to use, and we could support you with naturopathic options so you don't experience some side effects from pharmaceuticals. So it's really giving them just like, hey, you can do like those pharmaceuticals, but I will help you out at the end of the day in regards to like some possible drug nutrient deficiencies that might go on, or some things that might affect your gut microbiome, so that you could actually go on this pharmaceutical without experiencing much of these adverse effects. And just having that just really candid and true conversation with patients, they tend to just be really happy in regards to like, oh, hey, like these are what my options are. And I feel, and patients say that they feel more comfortable in regards to like moving on with like more integrative options. Does that kind of answer your question?
Yeah, very much so, because it's really what I'm really hearing from you is that it's really about helping the patient make an informed decision about what their options are. Fair enough?
Exactly. Yeah, that's all. That's what I was trying to say in so many words.
And you did.
Blabber.
You totally did say it too, because, sometimes for patients, there can be some hesitation, in terms of seeing more than one type of healthcare practitioner, especially if those practitioners have either approaches or use modalities that are quite disparate, that are quite different. So for you to be able to act as that bridge, if you will, between, naturopathic and conventional medicine, and in fact, also a bridge between different healthcare providers to form that team that you described, right? So the patient really feels that not only do they have individual healthcare practitioners in their corner, but there's a whole team that really has their back at the end of the day.
Exactly. And at the end of the day, one provider can't provide everything, right? So I just let my patients know, like, this is what I'm good at, and this is what I can't do given like the laws in California. So let's try to make you a really great healthcare team for you to get to your healthcare goals.
That's it. That's exactly the goal. Well, we could spend a lot of time discussing these, integrative and collaborative issues and getting more into skincare, but that's about all the time we have for today. So first, thank you, Bryant, for joining us, because you've given us some really great information about, what are some potential root causes of skin conditions, how naturopathic medicine, as a standalone and also being integrated with conventional therapies while you're collaborating with other healthcare providers, how that is really helping center the patients and forming that team, as you mentioned. So listeners, you can find a transcript of this interview and also some links to learn more about Bryant's work in the podcast notes. But Bryant, final word to you. Is there any final notes you'd like to leave us with today?
Yeah, so if you guys are experiencing any chronic issues, naturopathic doctors are really great at addressing those underlying causes, and we can work with you integratively and holistically, So it would be worth your while if you really wanted to look into adding a naturopathic doctor into your healthcare team. That's basically what I just really wanted to put out there. And we are just, how would you say it? We're trained in both pharmaceutical and natural options. So you kind of get the best of both worlds, and you kind of get a balanced perspective in regards to how you can get to your healthcare goals with different types of treatments.
That is the perfect note to leave it on today, Bryant. We have balanced healthcare. We're hopefully going to have a balanced microbiome, and everything hopefully will be in balance for all of the patients that you're dealing with. So Bryant, again, thank you so much for joining us. It's been such a pleasure to speak with you. And listeners, thanks for joining us as well. And we'll see you next time.